We are recording.
Hi, this is Dr. Andrew Carroll. I'm a family physician practicing in Chandler. I also serve as the Chief Medical Officer for ACO Partner, which is the value-based collaborative that you all have contracted with for shared savings. In the commercial space, we've created a program around COPD management, and we'd like to introduce you to it, and we want to engage with your patients who we have identified as either possibly or probably having COPD. And this program is a way to engage with your patients between visits so that we are identifying patients who might be experiencing exacerbations, so that we are engaging with them in very short order to identify the exacerbation and get them engaged with your office so that we can reduce the risk of morbidity and obviously mortality. And so this program has peer-reviewed, evidence-based guidance which has reduced overall morbidity and spend by greater than 50%. And so we know it works. We've already engaged, been involved with them as well as practices. And this is our invitation to you to join your patients into it as well. So with that, I'm going to hand it over to Debbie Bernstein to discuss the remainder of the program.
Thank you, Dr. Carroll. I appreciate everyone's time. I'm going to give you a short overview of the program, the benefits for the patient, and how this will work within your office workflow. The slide that you see in front of you shows the patient on a smartphone. This is a simple to use, life-changing results for these patients. It is brought to you by ACO Partner. It is a web-based application, phone or a tablet. It takes about 2 minutes a day for the patient to log their daily symptoms. And the symptoms that we look at are the breathlessness, sputum, peak flow measurements, presence of temperature, and presence of cough, wheeze, sore throat, or nasal congestion. We do provide a peak flow meter, and we do all of the education and coaching with the patients on how to use both the application as well as the peak flow meter. Our goal is to identify early changes in the patient's symptoms to identify an exacerbation. It's not a diagnostic tool, but it helps the patient really keep track of their day-to-day symptoms and the change from one day to the next. How it works is that the patients complete a check-in, which is the series of questions specific to their daily respiratory symptoms. And they complete the same questions every single day. And one of the questions that we hear is, well, do the patients really have to check in every single day? Actually, if we're going to identify the patient's deviations from their normal symptoms, it is important that they check in every day, but it is very easy, and it helps to be able to, they get into a routine with it. It's almost like brushing their teeth. And in the first 2 weeks, the application learns the patient's baseline and determines what's typical for them. Every COPD patient is a little bit different, so what is typical for one patient may not be typical for another. And with that, it's important to understand where their day-to-day deviations are from their own symptoms. And then the application provides feedback to the patient, prompting them to call their healthcare provider to discuss changes in symptoms and to determine a course of action for them. What you see in front of you are the screens that the patient sees. These are the series that they go through. It is very simple. It is very colorful. It's interactive. It's a small number of screens. It is very user-friendly. We have excellent usability experience. And as I mentioned, it becomes a habit almost like brushing their teeth. The average age that we have is in the 70-year-old range. So when we've heard, well, I'm concerned because some of the patients are older, we have not found that to be a barrier whatsoever. And 80% of the patients or more check in every day, continuously, routinely, and we really don't have a problem with patients not checking in unless there's been some disruption for them and they've ended up either in the emergency room in the hospital. But the idea is that we try to prevent that from happening to begin with. We do spend a lot of time educating patients on how to assess their symptoms. Wheezing. The CareLight feedback is very personal and very evaluation, we spend 2 weeks establishing the patient's baseline, their fingerprint that determines what exactly what is normal for them. And then the daily check-ins determine where there's a symptom change from their normal, their version of normal. And about 85% of the time when the patient checks in, they have no symptom change, and the app just says, thank you very much. Don't worry, there's nothing, nothing else for them to do. About 15% of the time when the patients check in, they've had some level of change, and most of those are mild. Another 10 to 15% are moderate, and some are significant, but the majority of those symptom changes really are mild. And all check-ins with some level of change prompt the patient to call their healthcare provider's main office phone number. So as I mentioned, the daily compliance is very, very consistent in terms of patient engagement and check-in. It actually averages over 80%, and in most cases in 90% across all of our patient populations. And the utilization, as Dr. Carroll mentioned, the utilization, you see changes with that as well. So we've seen a 70% decrease in admissions, and even when the patients are admitted, the length of stay is shorter because the exacerbation was caught earlier on in the process, and the exacerbation didn't escalate that much further. I think sometimes patients aren't sure, is today really different from yesterday or is it not? The app helps them determine that, and then it catches these exacerbations earlier. We do have a good deal of range in terms of our patient population. We've got all different payer mixes. 80% of our patients have 3 or more comorbidities, and we've certainly have a pretty large age span between ages 48 and 93 years old, with the average coming in at about 70. It's always good to hear what other providers have said about the program and who found it to be a game changer in his clinical practice. And as Dr. Carroll mentioned, it helps you keep an eye on the patient in between visits. We know that patients get their care when they come into the office for a visit, but it's very hard to know what's going on in between those visits, and that's exactly what this app is designed to do, to be able to a certain extent in between those visits when you're going to see them again. And it does work within your routine practice workflow. So when the patient has a symptom spike, they are prompted to call your office just as they would for any other, I'm not feeling well, I have a cold, I have a fever, any of those other routine ways that the patient would call your office for a sick call. This follows that exact same workflow. So the ACO Partner CareLight Care Coordination Line handles all of the patient outreach, recruitment, enrollment, patient engagement, and technical support. So if the patient is having any difficulty logging in, or they're getting error messages because they've entered peak flow meter numbers that are inconsistent, so we work with them to make about the system and about the peak flow meter and about how to report their system, their symptoms. We do share with each practice a list of the patients that have been identified, and patients in your practice that are appropriate for this program but haven't been identified can be referred in at any time. We work within your practice workflow. The patient calls the practice regarding the symptom changes, and then you handle it the way you do within your particular practice. So one question that we hear a lot is, well, how much extra time does this take? How much time and how much work is this for the staff? We do this to a portal so that you can see the exact same symptom check-ins as the patient is seeing on their application. But the idea is that this does not add to the burden of the practice staff. They can access the logged symptoms in the web portal and hand that off to the provider so that the provider sees the exact same thing. If for some reason that can't happen, the patient can report, they can see on their app exactly what their symptoms are, and they can describe those back to the PCP. We find that the portal is helpful it is something that we work to make sure that everybody has access to, but if for some reason they can't get to it, the patient can go ahead and they can report back their symptoms. What you see in front of you right now is the CareLight portal. This is what the practices are given access to, and it's very similar to what the patient will see. The patients anchor that 2-week baseline and what is normal for them is over on the left-hand side, and it stays locked right there. Every single check-in is then in reverse chronological order, so the most current one is next to the anchor. And the patient is given a score. You can see that the green ones where there's no change, there are yellow ones where there's a mild change, and then there are reddish orange ones that are more of a significant change. Logging into the portal, you can take a look at this. This can be handed off to the physician to be able to show when Luke Skywalker, in this case, calls into the practice saying that this application told me that I should call you about my symptom spike. This gives you the insight into what exactly the symptom spike entailed, where the problems were. This can also be viewed in a longitudinal way, and it can be printed ahead of a patient's visit. If the patient is coming in next week and you'd like to be able to see whether they've been checking in and what their check-ins look like, this can be added as just another component of how that patient is doing. So it is important to note what the intended use of this program is. So this system is intended to be used by patients as a support tool to help them, and as a support for the healthcare providers to be able to gain some insight into exactly what's going on with their patients. It is not intended to provide real-time monitoring. It's not an alarm system or an alert system, and it should not be used if the patient is having an acute exacerbation and you're expecting to be notified immediately. The CareLight should also not be used as a substitute for professional healthcare judgment and should not be used for direct diagnosis. Only healthcare providers should interpret the patient-reported data. You will receive your program launch packet, which includes an overview of the CareLight program, how the patients were selected using medical claims and maintenance medication prescriptions, and a sample patient outreach letter, along with a listing of potential patients and your current attribution roster to review and add patients as appropriate. For the next steps, I'd like to turn it over to Sheila Patel.
Thank you, Debbie. This is Sheila Patel, Director of Physician Engagement for ACO Partner. What I wanted to talk to you briefly about was what you're expected to do once listening to this orientation session. The first thing you're going to receive is the packet that Debbie just mentioned. It's going to show all the sample materials, the patient letter, of course. It's going to also include two patient lists, or two files rather, with patient lists. One is going to be your entire ACO Partner membership list. The other one is going to be those we have already identified as having COPD or would qualify for the program. What we would like you to do is review those two patient lists, the first one being the COPD list, to ensure that all of those patients should be enrolled. It's an opportunity to point if a patient was erroneously flagged as having COPD, and we wouldn't engage with that patient. The other list is an opportunity to pull in any other patients that you feel within the practice would qualify and would benefit from this program. And we can pull that patient into the program and then start engaging them and give the welcome packet to them as well. What we do ask is that as you review the patient list, that if you can return that list back to your physician engagement team, either directly to the team or that provider services email address that's listed here on the screen, we will go ahead and get that information scrubbed and then sent off to go ahead and get the packets rolled out. But if we can get that turned in around 1 week after this review, that would help ensure that we can get the patients in a timely manner.
Great.
No.
So are there any questions from the group? All right, if there are no questions, Dr. Carroll, do you have any final words?
Only I appreciate everyone's interest and involvement in the COPD program. The program is designed to be responsive to the primary care physician, the patient primarily, right? This is all about taking care of patients who have COPD, and then to give us a tool that our care coordination teams internally, and then your care coordinations and medical assistants and nurses can engage with as well. Given the and patients and to make it fully scalable as we continue to grow, we have chosen to engage primarily PCP patient and us as the care coordination team in this paradigm. So therefore, patients who you might have referred to pulmonology or have chosen to self-refer to pulmonology for management of their COPD, we'd ask that you employ a workflow that would account for that. So if you are being alerted that a patient is having an exacerbation and you have determined that the patient's COPD is being managed by a specialist, that becomes part of your workflow. Now, as we all know, and as I know, pulmonologists are not always the most responsive when there is an exacerbation. A lot of times they'll tell the patient to go straight to the emergency room, which is absolutely not the goal of what we do here. So if you a reliable pulmonologist who does do same day, great. If not, please engage with your patients before they get worse. They're looking to you for help. And that's why we've put this program in place, so that when the time comes, we've identified when they're having their exacerbations early, and they are engaged with you, who they call their family doctor.
We actually have a couple questions. Thank you, Dr. Carroll.
You mentioned that the site coordinator will need to activate an account. Is this a requirement of the program? Our practice is concerned with the amount of time involved for the practice to be a part of the program.
So we do get the practice site coordinators do have access to the portal, and we strongly recommend that they go ahead and that they activate that account. When the patient calls in with the symptom spikes, if for some reason the site coordinator can't get onto the portal or doesn't have access, the patient can read off of their phone or tablet or the website exactly what those symptom spikes were. We find that the portal is a good tool in order to be able to help streamline that communication so that the provider has that information in front of them. It is not required, however, it is very strongly advised.
Okay, one of the questions I've had before is, and I believe you mentioned it a little earlier, what kind of ongoing work does this create for practice administration or staff?
So 85% of the time, patients don't have any symptom spike at all. And they go through their day, they check in, and everything is fine, and they won't be calling your office at all. The only time that it does start to add to the regular practice workflow is when the patient does have a symptom spike, and they would be calling you just as they would if they had any other medical condition. We don't expect this to add any further burden to the practice. This would be the same thing, it's just that they would ideally be identifying their symptom spike a little earlier on in the progression of the exacerbation. So if we're catching it earlier, managing that symptom spike should take less time than if it waited a little bit longer and then the patient is calling with a much more severe symptom spike. But it is within the regular workflow of the patient contacting your office in order to be able to say, you know, I'm just not feeling well. This is the same thing, except now you've got a little bit more information to be able to respond to the symptom spike itself to know whether it's something that requires a bronchodilator versus prednisone and antibiotic. Great question, by the way. Thank you.
Another question, do we record their symptoms daily?
We are not actually, at this time, we are not providing tablets or cell phones. The belief and what we find is that most patients can download the app from the App Store, that they either have a cell phone, a smartphone, it is Android and iPhone applications, and if they don't, that they do often have access to the web. So we've not found the need. So what we're doing at this point is the patients usually have that access, and we haven't found that to be a problem.
So given that information, are the patients required to check in daily? And if so, is that something that's constantly monitored?
So the patients are required to check in every day. This is part of the reason why we watch from day to day to make sure that the patient is checking in. If the patient doesn't check in before 11 o'clock, the recommendation when we educate the patients is they check in first thing in the morning. It's just easier, like brushing your teeth. You get into a habit. If they haven't checked in by 11 o'clock, our health assistants will contact the patient to remind them to check in. They will get a notification and they'll get a call from the health assistant reminding them to check in, and we do monitor that over time. And for the most part, if the patient has forgotten, that simple reminder usually takes care of it. If they still have not checked in, then we will start to work with them to identify whether there's been a particular problem. Did they land in the emergency room? And we will work with the ACO Partner Care Coordination team. Any other questions? All right, well, I think that's it. If you have any further questions, reach out to the physician engagement team, and they will be sure to get those questions back, and we will get you an answer as soon as we can. Thank you very much for your time, and we look forward to working with you.